All right. Here we are at section 2 with Sally, Voices of Courage. Sally, the students are going to start learning about the Code of Ethics, the NASW Code of Ethics, and how you connect ethics to practice. How are ethics important to you in your practice?
I use ethics every day when I think about who my client is. My client is the child. So there's a special set of circumstances that I work with working with a child. I have to build their trust and um, rapport while also maintain their confidentiality while also keeping parents informed and keeping parents abreast of what we're working on and how they can best support their child at home, and also involving them in the treatment planning and the work that we're doing.
Absolutely. So, do you run into ethical dilemmas here at your practice?
Absolutely. The children that I work with are oftentimes going through a legal case. Either it's a custody battle that's going through civil court, or a criminal case where their abuser is being prosecuted.
Right.
And I have to always think about, do I have the right paperwork signed off to be able to talk to different lawyers and the prosecutor and the guardian ad litem, who is the lawyer for the child, to make sure that I have everybody informed of the information that they need, once again, while also protecting confidentiality.
Right. Confidentiality is really critical. I I know just in my supervision and education of social workers that isn't just conversations, but it also includes documentation. What can you put in a progress note versus what should you not put in a progress note? What are the ethical guidelines? How important it is to document accurately, but also at the same time protecting. I mean, a child says to you, "Hey, Sally, I'm 12 and I'm drinking beer on the weekends, and my mom doesn't know." How do you document that within the scope of ethics and best practice at the same time? So it could be challenging.
It can be.
So, um, what's an example of a dilemma you've had recently? An ethical dilemma.
Um, let's see. A recent one is I had a client come in who was very unstable. She's 5 years old and has a long history of both sexual abuse and another traumatic event that happened that led her to the hospital. And due to that, she's got PTSD and severe trauma reactions. And when she and her mom came in for an appointment, mom shared that her emotional state and her verbalizations and comments that she's making told me that she was very unstable. So I had to find a way to make sure that mom understood the severity of the situation and bring her to the hospital for further evaluation and help from medical staff.
That's a great example. Great example. So when you have an ethical dilemma, um, you might explain to my students, you have a whole team of people here that you can do peer supervision with. So do you try to solve dilemmas in your own little bubble, or do you seek peer supervision and support from your colleagues?
Oh, absolutely. I seek peer supervision. I mean, we talk about situations and um, different dilemmas that we encounter almost on a daily basis.
Yeah, absolutely. Yeah, absolutely on a daily basis. All right. Well, thank you, Sally. I'm going to go ahead and sign us off here for section 2. Appreciate your time. Well, we're back with Ashley, and we're going to continue on this um, guest lecture. So we're going to talk a little bit about ethics. Ashley knows well that ethics are really important to me, and one of the best fits for her and I as a supervisee and supervisor was that it was also important to her as well. So, what is ethical practice like in hospice care?
Can be very challenging. We are, like I said, guests in their home, and
Guests in their home, yeah, that's a good one. Good
a
point.
lot of the families, though, in the hospice realm really become attached to their hospice team. and kind of incorporate them as their own family. And it starts to blur the lines between who is their care provider and who is their family. And you start getting invited to family events, to holidays, to weddings, and having to maintain those boundaries and let them know, I appreciate the consideration. I appreciate how involved you would like me to be, but I am here to be your social worker, and I am here to help you through this journey in your life. But also remembering what their culture is like too, because you might walk into a home where they always have food out and they want you to eat because that is their culture. And so ethics isn't always black and white. It's not always perfect, but being able to understand where they are and where you stand as a social worker in your own ethics is vital. And I have had many opportunities where other team members, nurses, bath aides, even our own supervisors don't see eye to eye with us because their ethics are very different than social work. And having to remind them and help guide them or even teach them what is going on so that you can continue to provide the best care for whomever you're taking care of.
I supervise another hospice social worker, and we were having a conversation about ethics, and she and a nurse were in a home, and they had gone back to where the client was, and he was in his room in bed, and the wife was there, and the nurse was checking, his colostomy and some other things. And the mom was very specific in saying, when you're done, wash your hands in my bathroom. And when the nurse got done, she went and washed her hands in the client's kitchen sink. And the client was really upset about that. And the nurse, operating from her ethics, the kitchen sink is a cleaner sink to wash your hands from, but didn't understand why the client was so upset. And having those really good boundaries, because you are a guest in the home, is really critical. And I can imagine that would be an easy place to go south on your ethics, to develop a dual relationship, to kind of forget what those boundaries are like. What was your hardest ethical dilemma?
I think the hardest one that I had was a young man on service who was living with his parents, and unfortunately mom was an addict and was misusing his medication. And we really had to find a balance between keeping him comfortable so he could enjoy whatever days he naturally had left, and also working with mom to help her with her issues so that he can have access to his medication to maintain comfort.
Yeah.
And
yeah.
that was a real battle, as she just would not participate.
Yeah, I can see that. So, all right. Well, thank you, Ashley. Thank you for sharing. Well, hey, class. Welcome back to segment 2, which is why are ethics important? One of the reasons why I reached out to Jackie to ask her to be a guest lecturer in Foundation is she really tugs at my heartstrings because she is a student of ethics. It is something that's really important to her. So I am really, as I've given all my social workers kind of heads up what the segments are about, I am pretty excited about this because she's really put a lot of thought into this. So how are ethics important to you in your practice as a social worker?
Yeah, I had a hard time narrowing this one down.
It's only that
I know,
long, so,
right?
yeah.
So ethics are just fundamental. I think that for social workers, our ethical principles serve as a guide for how we conduct ourselves in the field. And while all of the ethical principles and commitments to clients, the profession itself, to other professionals, those are a constant in my practice. I am always thinking about those, whether I'm working specifically with a client or just staffing a case with somebody. And so the ones that stuck out to me when I was thinking about this in advance or in preparation for this was self-determination is one that really stands out to me in domestic violence, because we can never ever be the expert in that relationship.
Absolutely.
And so it is crucial that we are viewing our client as the expert in that relationship, because they are, and the information and experience that they bring to the table informs the services. It informs what we do together, the safety plan. Every decision made is based in safety, and so sometimes that looks like staying in an abusive relationship, or sometimes that looks like trying to leave. And I cannot judge them for whichever choice they make, because it is the safest choice they can make at that moment in time. And so I have to recognize that they know what their needs are. And I think that we also need to avoid replicating that power differential, so domestic violence is based in power and control, and there's an inherent
Absolutely.
power differential. I'm a worker, they are a client. Just labels alone, there's a power differential, and so I work very diligently to mitigate that the best that I can, to meet the client where they are and work together, and know that I am here to support them. And that often looks like those decisions that make no sense to anybody on the outside of that relationship,
Right.
but in it, I trust that they are making that
And
safe.
because we work in multidisciplinary teams,
Mhm.
not everybody we work with is a social worker.
Right.
So their understanding of that lens of self-determination is so very different,
Mhm.
because they would just look at it, well, why would that individual continue to be in that really awful relationship? That just makes no sense.
Mhm.
Unfortunately, you're not looking at it through their eyes, you're looking at it through your eyes, and at that point, you're really negating self-determination. And that is so frustrating as a young social worker, is to learn to allow a client to make their own choices, whether they're good or bad, whether they succeed or fail. It's really challenging for young social workers,
Yeah.
and sometimes old ones. So,
Yeah, and it can be frustrating, but I think it's really valuable, because when I have effectively communicated to the client that they are driving these services, they are informing what we do, and I cannot do my job without them, it does give them a sense of empowerment and control back in situations where they may not have felt that for a very long time. So that can have its own benefits and drawbacks on its own. And so it's tricky, but using ethics as your foundation and your guidelines helps you navigate through those various situations.
absolutely. Now, a big part of victim advocacy here at Rosebrooks is confidentiality. And I know you wanted to talk a little bit about that in regards to ethics. So what are your thoughts?
So confidentiality is huge. There are specific laws for victims of domestic violence and sexual violence on the municipal, state, and federal levels.
A lot of moving parts.
A lot of moving parts, lots to know, lots of context. And I think for me, the most important piece of maintaining confidentiality is the informed consent, is that domestic violence touches every piece and aspect of somebody's life. It is not just at home. It is their employment or ability to access it or not access it. It is their transportation. It is their school and education. It is their kids. So it is all of those pieces. And so confidentiality is key to maintaining their privacy and their access and their rights to services in a confidential setting. Our location is confidential. I can neither confirm nor deny without express written consent. So I that comes up every day, all day, and it's very important to maintain.
Very important, very important. It is an integral part of the whole process to break the cycle of domestic violence confidentiality. So, all right. Well, thank you, class, for joining us here with Jackie on segment 2 on ethics. So, welcome back. We're continuing with Erica, section 2 about ethics. So she is at Restart, which is in the heart of Kansas City. It is a program that has a lot of moving parts. They work with a variety of age groups and have a variety of programs that they offer. So because you have so many moving parts working with such, vulnerable population, marginalized individuals, how to tell my students a little bit how ethics important to what you do here at Restart and in your practice as a social worker?
Sure. Ethics is something that helps here specifically in this agency, but me kind of set boundaries within right from wrong to some degree, but also within my parameters of what I can or can't do. Ethics helps in decision making when it comes to the families that we serve or the youth that we serve. And I think without ethical standards and guidelines through our code of ethics, there's a lot of opportunity for enmeshment of relationships and blending of lines and blurring of lines. And ethics help us to kind of set that line and that boundary of I'm here as a professional. While I care about the people that I'm serving and I want to help them as much as I can, I also have to have those kind of lines very clear for the clients that I serve and work with, as well as my colleagues too, to make sure that I can be okay and take care of myself and do the right things the way that they need to be done based on that standard of code of ethics.
What do you find is the most challenging dilemma that you might have any week or day to day within the code of ethics?
One that comes up pretty frequently is hotlining. We have an emergency youth shelter, and so that serves youth ages 12 to 17. And so we get a variety of youth that come into the shelter for a wide range of reasoning. And so there are times when we may need to hotline or we may not, and we kind of lean on that code of ethics to determine, is it appropriate, is it not appropriate, is there something else we can do before we make that hotline report. And also with the families that we serve in our family shelter, whether it's disciplining, leaving them unsupervised, being out overnight with their children here and nobody. So usually it's that family dynamic when those ethics come into play most, but also in relationships with clients and not having dual relationships. It happens a lot here. And so really being able to set the boundary and the standard that having those dual relationships is unethical, and being able to refer back to say, here's why it's unethical and here's what else we can do to serve that purpose.
That's perfect. Thank you very much. I remember we staffed an ethical dilemma earlier in supervision, which was selling an agency vehicle, a used vehicle, to a former client. And you had reached out to me to sort of pick my brain about that. What was the end result of that dilemma?
I was able to educate folks who were involved, who are not social workers, as to why that was not a good decision to blur, again, that boundary and that line. And we did not end up selling the vehicle to the client.
And at the time, I mean, it's easy to see why that would even occur.
Absolutely.
Right? We're going to sell it. We're going to help out a person.
Mm-hmm.
It's not about making a ton of money.
No.
It's about, getting them on their feet. But in the end, it really is also creating a dual relationship.
Yes.
So,
Yep.
All right. Well, thank you, Erica. That was a great case example. So.
Yeah.
Hey class, we're back again with Michelle White here at Truman Hospital, and she is a medical social worker. We're going to talk a little bit in this segment about the code of ethics and why ethics are important to her and her practice here at Truman. And one of the things that Michelle may touch on is that she doesn't work just strictly with social workers. In fact, can go the majority of her day and not see another social worker. She's working with doctors, nurses, PAs, nurse practitioners, labs, and not to mention a whole assortment of different kinds of clients. Mm-hmm. So why is the code of ethics important to your practice here at Truman?
It gives us a roadmap to know exactly what direction we need to go and what's social work appropriate, and helps us to stay in the social work lane. So we're not wandering into nursing's lane or the physician's lane. We know exactly where we need to go as a social worker, what our role is, and helps us to decipher what is appropriate for us.
So is it easy to get out of your lane?
It can be, if you have another professional coming to you asking you questions about something that you may not have the skill set for, or that's not social work appropriate, or they don't know where to go with it, they don't know who to contact, then it can be easy to wander out of the social work lane into something that we don't have the training or the skill set for.
Yeah, I, having been in child welfare, I would say to the attorneys, I'm not an attorney, so I'm gonna stay in the social worker lane, and you're not a clinician, so you stay in the attorney world,
Right.
and we'll get along really good at that point. So really knowing what your competencies are, working within your competencies, and knowing what your limits are.
Right.
So is there an interesting ethical dilemma that sort of comes to mind?
There are instances where, we look at a chart, we feel that something is necessary for a patient, like oxygen, something like that, but the physicians don't necessarily see it that way. Our role here is to provide a safe discharge plan. And, some physicians don't always think that, well, they don't really need oxygen. So we kind of battle back and forth about some of these items that, we feel is important for a safe discharge plan and that we are looked to provide, but other professionals may not feel the same.
Right. And I remember when you and I used to staff cases, that was a common theme. It was just a disagreement of where you're coming from.
Right.
But sometimes you really have to dig in there and really fight for your client.
Right.
And sometimes can be a challenge, especially when you're working with such a wide, diverse type of clients.
And then on the flip side of that, a discipline could be pushing for a patient to be placed, simply because they're old or, really no good reason other than they need to go to placement. And this is where self-determination comes into play, because the patient, I don't want to go to placement, I don't need to go to placement. And just trying to help educate that, I can't force someone to do something that they don't want to do. And I believe that it's actually probably against the law to force someone into placement against their will. So it's also, fighting for our patient's self-determination that no, just because a patient is 70, 80 years old, doesn't mean that they need to go to placement. They don't want to go to placement. They don't desire to go to placement.
I think that is a really great example. We've had some conversations from other social workers about self-determination. And I think even at this level of care, how important that truly is. A patient still is part of the decision-making process, even though they may not be the expert of cardiovascular issues,
Right.
where the doctor is, they still have that they still are the expert of themselves.
Right.
So, all right. Well, thanks, Michelle. Hey class, we're back with Trayvana Alexander at Kansas City, Missouri School District as a school social worker. And we're going to talk in this segment about ethics. So, like a lot of the social workers I've been interviewing, you don't just work with social workers. I mean, you do, but you also work with teachers and nurses and principals. And prior to being at Kansas City, you were at Cornerstones of Care as a foster care case manager, supervisor, program director. Again, you worked with a variety of people. So how does the code of ethics play out in your work here as a school social worker, and how is it important to you?
Well, the code of ethics is extremely important. It plays out in almost everything I do. I mean, when you think about the roles we have in our work and what organizations expect from us, sometimes it isn't aligned with our code of ethics. But the code of ethics is a document that kind of helps shape our practice and really guides us and to ensure that the things that we're doing are in the best interest of the clients that we're serving. It kind of helps us assess if we have the knowledge or the expertise to do something. It kind of makes sure that we are operating uniformly as a profession. It's extremely important because when working with multiple disciplines, like you have different perspectives and ideas about how to achieve a goal or what's the best way to get there. And we may not all believe in the same modality or, intervention. The code of ethics really guides us in that and lets us know that when we're making a decision, we have a model to go back to and kind of compare what we're doing to see if we're on the same lines.
So, what's probably as a social worker in Kansas City, Missouri School District, what is an ethical dilemma that's probably most common?
I think with us, one of the most common ethical dilemmas that we face with the Kansas City School District is identifying safety risks for children and whether it's something that should be hotlined or not. And for most individuals that I work with outside of the social work discipline, everything they consider a hotline. Oh, the child said that they don't want to go home today. I think we should hotline that. And so really assessing those situations and providing learning opportunities, as a social worker, we know, well, I know, and then following our code of ethics, that we have to assess the safety concern and really make hotlines in good faith. Yes, you don't have to have proof or document evidence, but it should be in good faith. And with, just general kind of terms like that and statements like that, to make a hotline wouldn't necessarily be in a good faith, and also we would have to, consider the implications of the family, the child, and our relationship, the relationship between school and home.
Right.
So that's one of the.
I staffed a case recently, and had you been there with me, it would have broke your heart. It was a case of two kids, 10 and 4, who were living with a grandparent who was struggling with cancer, and whose doctor had said, to sort of ease your pain and maybe improve your appetite, you maybe would benefit from some THC.
Mm-hmm.
So the mother, who's angry that her kids aren't with her, told her therapist,
Mm-hmm.
and the therapist just hotlined it, and the kids were taken into custody. And what we don't know, right, is were the kids really in jeopardy? Because
Right.
a parent using a drug by itself isn't a hotline, but a parent using a drug, driving a car under the influence
With the
kids
children in the car is
hotline every
hotline.
day.
Yes,
And
absolutely.
just staffing that case, I wonder, going back on what you said, did the person who made the hotline think about the ramifications?
Exactly. And a lot of times they don't, and a lot of times they don't know what those ramifications look like because this isn't their area of mastery. So
All right. Well, thank you, Eric. I appreciate it.
you're welcome.
All
Great.
right. What a goof.
That's all right. Did you?
Hey class, welcome back. We're in another segment here with Flora at Rediscover. And we're going to talk a little bit about ethics. So Rediscover, being a community mental health center, is different than some of the other agencies we've gone to look at. We've been in profit, for-profit, non-for-profit. Well, this being a community mental health center, it is a nonprofit agency, and the staff that she supervises may or may not have master's degrees or even bachelor's degrees in social work. So she works with a wide variety of people. So why is ethics so important to what you do here at Rediscover?
So ethics, of course, is what guides our decisions personally and professionally, and it really sets the standard for how we practice and how we treat our clients. And so it's very important because it just really allows us to set a standard of how we just treat one another professionally, how we just treat mankind, and literally how we maintain the treatment and the fairness of all our clients.
Have you had an ethical dilemma in the last year that sort of sticks out that you had to sort of address? I know you have, so I'm curious what you're going to say.
Well, I had to address several ethical dilemmas. Now, not in my mind were they ethical dilemmas, but I can see how for some case managers or some individuals would feel like it was a dilemma. So I had one particular individual who was very passionate about her clients and the ones that the individuals she worked with. But the client called after hours and asked would she pick her up because she felt like she was stranded, and then wanted her to, like to pick her up and take her home. Well, of course, the individual could not, so she sent her spouse. And so that was a major ethical break for us. One, because her spouse does not work for Rediscover. And then just setting that boundary for that particular client, because then the question became, would you do that same thing for every client? Would we provide, would every case manager treat the client the same way? And so just for that individual struggling with that decision of, coming from a place of compassion, but understanding and recognizing the ethics and HIPAA along with that at the same time.
Right.
Mm-hmm.
Absolutely. One that was coming to my mind that you and I had staffed, you had inherited some staff when you moved into the management position, some staff that weren't being honest
Oh, yeah.
with their documentation, with their mileage. That is also another example of an ethical dilemma. Fraud, waste, and abuse
Oh, yeah.
is certainly an ethical issue. We're supposed to, do what we say we're going to do, and then do it, and then document it and capture it and be honest about it. So you've certainly had ethical dilemmas from the client's perspective, as well as the staff perspective at that meso level, and then certainly at the macro level. What is Rediscover's mission statement and its vision and the direction that it's going? So ethical dilemmas can be at all of those levels.
Yes.
So, all right. Well, thanks, Flora. Appreciate
You're
it.
welcome.
Hey class, welcome back. We're continuing with Evan here, who's at KU Med Center. And we're going to talk in this segment about the Code of Ethics and how it applies to his practice here at KU Med Center. So what's that like for you, trying to work within the roadmap of the Code of Ethics, given the wide diversity of people that you have to work with?
Case in point, and something I always brought up when I was in supervision with you, is I work in a large hospital. It's very monetary driven, which means that they want to bring patients into the hospital and then get the patients out nice and safe. A lot of times, ethically, you can't really rush that. And so in terms of the Code of Ethics applying to what I do here, it's always putting the patient's interests first. The other code is obviously human relationships and the importance of that. And so taking the time to establish that rapport to really understand what the patient needs. And then the other one is advocation. So advocating for whatever the patient needs, trying to help the patients and also the hospital navigate that route with whatever is needed. So that's how the Code of Ethics for me really applies strongly to the hospital.
Can you think of an interesting ethical dilemma that you've had maybe this last year that sort of sticks out?
I can't go too specific. The end of life ones for me are very difficult to navigate, especially when you have somebody who, for whatever reason, is impaired cognitively, so can't really make their own best decisions, and then they're presented with an option of either having or not having a life-sustaining treatment, and then you have a large system, including the state, who's kind of dictating what services that patient is going to or not going to receive. So that's one of the big examples. A common one is dialysis. So the need for dialysis, obviously life-sustaining.
I remember we had staffed a case a long time ago. It was a patient that was aggressive, and the doctors had just decided no more dialysis.
No more dialysis.
And which meant, the beginning of the end for that patient. And that's difficult for us because that isn't really our code of ethics. When we have to work with a medical team in biomedical ethics, sometimes our ethical view and those will, intersect instead of just being a nice parallel path. So, all right. Well, thanks, Evan. Appreciate it. Thank you so much.
Yeah, thank you.
Hey class, welcome back. We're here with Sonia Duran. She's a social worker at Children's Mercy Hospital, and has been here for a pretty long time. So in this segment, we want to talk a lot about the Code of Ethics. So obviously, you're well grounded in the Code of Ethics. You learned about it in graduate school. You have to use it in your skills here at Children's Mercy. What does the Code of Ethics mean to you, and how do you use that in your practice?
It's a very important part in my daily life because we do have to apply it every day. I mean, I work with clients every single day, and I gotta make sure I apply them because there is this gray area, I would say most of the time. So I gotta think about the ethics part.
All right. Can you give an example of an ethical dilemma you've had to sort of work through that sticks out in your mind?
Right now I can think of working with a mom who she was not concerned about the safety of the child. This child has been seen by the doctor, and she did not want to be seen by the doctor. She just started to cry, and she was very upset about it. I had some concerns, but of course I had to respect what her mother was saying, or she was thinking, because she was saying, I gotta respect my child. She's a 9-year-old. And if my child is okay and she doesn't want to be seen by the doctor, I got to respect that. And here I'm thinking, well, I mean, first is her safety, but I also have to respect what her mother is wanting, or what the child is wanting. So of course I'm gonna check for safety, but I'm also going to make sure that I'm gonna respect what the mom wants or the child wants.
Right. Yeah, that respecting our clients can be, I think, challenging for especially newer social workers to the field. They may see social workers and their practicums tell clients what to do, but that's not really what our training is, and so it can be really difficult. So, well, thank you very much, Sonia. I appreciate it. Hey class, I'm back with Melanie at Truman at the Futures program, and we're going to talk in this segment about the Code of Ethics and why ethics are important to her and to her practice, and important to her work here at the Futures program. So I've had some of my other guest lecturers talk about it's a roadmap, right? It helps give us some foundation and some direction. So aside from that, why is it important to you?
I mean, that is a big reason why it's important, for sure. It is a foundation, it's a roadmap, but also, the world is not black and white.
Oh yeah.
And so we need, ethics gives us, that outside framework to make decisions. I mean, we're always using, or I feel like I'm always using my clinical judgment, but there's so many times where things just don't sit right. And so I need to go back to those. The social work ethics help me make decisions that I feel are better for my patients, for my clients, because it can get, we're human beings, and we can make mistakes. So I think it really helps to minimize that we have, client self-determination, that we have advocacy, we have all these ethical guidelines that help us make better decisions and better ethical, better clinical judgments and decisions.
Right. Well, and when you were in the mother-child baby unit, big parts of your day, you're the only social worker. You're surrounded by nurses and doctors and other medical, professions. So it gave you that framework to operate from. Can you think of an interesting case example of an ethical dilemma, one that pops to your mind? I know you and I have staffed quite a few back in the day. So,
I mean, when I worked on Mom Baby, I worked from delivery to discharge with moms, and there's times, you know, that a mom would come in, you know, positive for cocaine or meth or, you know, clearly with some serious issues. And, you know, for people, doctors and nurses, they don't have the same training that we do. They're very upset by this. You know, babies are born drug exposed, especially with opiates, where babies are going through physical withdrawal and are very ill. And, you know, people are angry. And that is a really great time that we have these ethics, because when you let your emotions step in, you're not making decisions for what is best for this newborn and this mom. You're making emotions based on your desire to, you know, for whatever. So, you know, those are the times where I use those ethical guidelines to make decisions, like who needs to come in, Children's Vision clearly, and there's a whole other debate about the ethics around that, but you know, how we can support these moms, how we can support these babies, you know, within a guidelines of what's ethical and proper to do.
yeah, absolutely. And I know that for me, my view of ethics as kind of a student of ethics, it doesn't match the ethics of everyone else. It doesn't match, you know, doctors' ethics and nurses' ethics. So I would constantly feel like I had a responsibility to teach ethics.
Yeah.
And that, I think, is an ongoing thing that just never ends.
Oh, absolutely. Yeah. I mean, that's, you know, in this current position, I'm surrounded by way more social workers, but in hospital, yeah, I was definitely one of the only social workers on the team, and luckily I was on a team that was very respectful of social work. I think it would be really difficult, and I know colleagues who work on teams but they're not. But you know, people did eventually they looked to you for that ethical information because you provide it so often. You know what I mean?
Right.
So
right.
you know, and I think that's good because you're helping people see how it's included in their practice too, as doctors and nurses and residents. And Truman is a teaching hospital, so you know, we're kind of helping those new doctors too to think about, you know, what are the principles behind this? What are we, when we're making these decisions or deciding, because these are life changing, you know, for could be generations. So you know, what is the right thing to do, and why do we think that's the right thing to do?
Right. I think that's perfect. Thank you so much for sharing with my class. I appreciate it.
Absolutely.